the Canadian healthcare system is riddled with problems like lack of available resources and technology.
There are people who actually die while they're waiting to see the doctor.
Canada is absolutely not better than it is here.
People have an opinion of the Canadian system, partly because of the work that I did. For 20 years, I was a senior executive at two of the country's biggest health insurance companies. This white binder was one of the tools I used to convince Americans that the last thing we would want in this country was a healthcare system like most of the European countries and Canada have.
Well, we don't want the socialized healthcare they have in Canada. We want American solutions.
This book contains page after page of talking points and misinformation. It was created for the sole purpose of misleading people.
Government runs healthcare in Canada. Care is delayed or denied. Some patients wait a year for vital surgeries, delays that can be deadly.
I really didn't know much of anything about the Canadian system other than the information and talking points I was fed by industry-funded think tanks and lobbying groups.
Canada is a country where a family can get a hip replacement for their dog in under a week, but a family member has to wait 2 to 3 years.
Since leaving my corporate job, I have been on a mission to try to make amends for the role that I played in perpetuating one of the world's most expensive and inequitable healthcare systems.
The practices of the insurance industry over the past several years have contributed directly to the growing number of Americans who are uninsured and to the even more rapidly growing number of people who are underinsured.
At long last, I learned the truth about the Canadian system, and I feel an obligation to tell that truth and debunk the myths that I helped create when I was an industry spokesman. Myth number 1, the Canadian system is a government takeover of health care. Everyone in the health insurance business knows that the phrase government takeover scares the heck out of a lot of folks.
And the American people don't want a government takeover of health care.
Which will put the government between patients and their doctors.
This is a government takeover of healthcare. That is
not
pure,
ideological.
absolute,
it is actual
incredible.
fact.
The truth is that Canadians have much more freedom of choice than we do in the U.S. They have a Medicare card that lets them see any doctor in the country. And they don't have to deal with insurance companies to get the care they need because health care is financed primarily with public funds. Doctors run their own practices and hospitals are privately operated in Canada. Instead of having to deal with multiple insurance companies, they simply bill the government for their services.
As a Canadian physician, I sort of laugh when I hear people talk about government telling me what to do or government-run healthcare. That's certainly not been my experience.
The government does not interfere in clinical decisions.
I have an enormous degree of clinical autonomy.
In fact, very early in the Canadian system, doctors established an agreement that doctors would be self-employed.
I'm in practice. I'm a small business person. They're not running my business for me. They don't come in and review me and tell me, you're not doing this right, you're not doing that right.
Canadian doctors make decisions based on their best clinical judgment, not what the government or an insurance company bureaucrat tells them to do. Myth number 2, people are dying in wait lines. One of the most frequently cited myths about the Canadian system is that Canadians are dying on wait list.
And if you wait too long in line that you happen to pass away, that just is part of the way the system works in Europe and in Canada.
That lie is fed over and over by industry lobbyists and PR people to the media, politicians, and the general public. Wait times in Canada are managed according to medical need. Longer wait times are associated with elective procedures that pose no long-term threat to a patient's health.
This myth about Canadians dying on waiting list is simply that. It's a myth.
On average, how many Canadian patients on a waiting list die each year? Do you know?
I don't, sir, but I know that there are 45,000 in America who die waiting because they don't have insurance at all.
If you need immediate cancer surgery, you will get it quickly.
The concept is that people should be seen in the order of need. As a family physician, if I see patients in my office who are waiting for, say, an appointment with a specialist and there's some change in their circumstance, that their situation has become more urgent or they're uncomfortable or worried in some way, then the system is set up for me to be able to advocate to get them seen more quickly.
In the U.S., if you're uninsured, you might not get any care or be on any wait list because you don't have enough money. I can't tell you how many times people have told me they were counting the days until they became eligible for Medicare. That doesn't happen in Canada. Everyone gets care. And doctors, not the government, calls the shots as to when the care will be delivered.
My wife, for example, went through breast cancer a couple of years ago. You wouldn't believe how quickly she got in for the initial scans, for the initial biopsies, for surgery, for chemo, for radiation. We didn't wait, and moreover, we didn't pay a cent for it. So there was no financial burden, and the quality of care that we got in our public system was as high as in any elite private hospital you can imagine anywhere in the world.
Myth number 3, the quality of care in Canada is poor. The myth of poor quality in Canada is a well-embedded lie in the American perception of Canada.
Let's try nationalized healthcare. Never mind that in Canada, people actually come to the United States and pay extra so they can get the care they want.
My former colleagues and I led Americans to believe that Canadians come to America in droves to get the quality care they can't get in Canada.
Canadians, when they need a big operation, when something happens, they come into the United States in many cases.
So what's the truth? There's no evidence at all to indicate a significant number of Canadians come to the U.S. for care. In a survey of 18,000 Canadians, only 90 had received medical care in the U.S. in the previous year. Only 20 of those had come to the U.S. expressly for care. The others were emergency situations. In terms of quality, Canada surpasses the U.S. in leading indicators such as preventable deaths and infant mortality. Breast cancer survival rates in Canada and the U.S. are virtually identical. Before Canada adopted its Medicare system, life expectancy there was roughly the same as in the U.S. Since then, life expectancy in Canada is 82 versus 79 in the United States. By a whole host of measures, Canada has equal or better quality metrics compared to the U.S.
The strength of public support for our publicly funded health system is incredible, and it comes out in many surprising ways.
Well, it started with a question: who is the greatest Canadian?
A few years back, Canadians were asked by the Canadian Broadcast Corporation, who is the greatest Canadian in history? Who do they most admire in the whole long history of Canadian heroes?
And I have the envelope here. The greatest Canadian, as decided by you, is
Tommy!
Canadians chose Tommy Douglas, the father of the Canadian healthcare system.
Good health services for every man, woman, and child, irrespective of their income, their age, or their physical condition.
The truth is that the vast majority of Canadians are very proud of their system.
The core value of maintaining healthcare as a universally accessible, publicly funded right of citizenship, that core value is virtually universal. There isn't a politician in Canada that would dare propose to do away with that fundamental nature of our system, because they wouldn't stand a chance. That's how solid the support is among Canadians for publicly funded healthcare.